Hi, welcome back to Talk of the Town. Lori Lancaster, licensed esthetician and laser technician, and Lynn Matthews, RN and master injector, talk about envisioning a refreshed and revitalized looking you with Envision Med Spa services at the office of Dr. David Remigio. Welcome.
Thank you.
Thank you for having us.
Such an important topic, especially after the first of the year. Everybody kind of wants to, you know, look their best.
Absolutely.
And so, Lynn, you work for an oculoplastic surgeon, and what type of surgeon is that? What's his specialty?
Dr. Remigio is an ocular plastic, and some people say, well, what is the difference in that and a plastic surgeon? Dr. Remigio specializes in nothing but the eyes.
Okay.
He specializes in upper eyelid skin, where people are having a functional peripheral problem seeing.
Right.
He takes care of that. And a lot of time people don't realize that insurance can pay for having your upper eyelids done. You have to meet medical criteria.
And so, Lynn, you are a master injector of facial cosmetic treatments. What is the difference between Botox and some of the other fillers?
I love the question. A lot of times people will ask me, say, well, what's the difference? They're the same, aren't they? They really aren't. Botox is a muscle relaxant type injection. The facial expressions that we make, we frown, we smile. When we're 20, you don't see the results of that with no lines whatsoever.
Right.
The older we get, with the aging process, you have the lines between the brows and you have the crow's feet. Botox relaxes those areas and makes it wrinkle-free. Fillers do exactly what they say they do. They fill up voids where the aging process has taken our collagen, and they say everything goes south. Well, you know, it turns that mouth down. It makes you look, unhappy.
Sure.
Filler fills up the lines, especially around the nasolabial folds and the mouth corners.
And so, Lori, as an esthetician, laser tech, and makeup artist, what do most people often complain to you about? What do they want to remedy?
Well, it's interesting because people often don't know exactly what's happening, but they most frequently just complain that they look fatigued, they look tired,
Sure.
They just don't look the same anymore, they don't know what's happening to them. So that's usually what happens, yeah.
And so for that, what do you do? Like, what do you offer that in specialized treatments that can actually help that?
Sure, so what usually is happening is, unfortunately, the first place on your face to sort of go south or change, we'll just say change,
It changes.
to change is the eye area. So what happens is the skin gets thinner.
Right.
You can see the blood vessels and veins more, which makes it look darker. We lose
Right.
a little fat, which can create a little hollow and make
Right.
us look more tired.
Sure.
The shadow, the lights are sometimes not our friends, depending. And then also what happens is the musculature changes.
Okay.
So what I can do is I do a FDA-approved treatment for periorbital wrinkles.
Okay.
That's called Gentle Waves. We're the only office in the area that offers it. And it builds collagen, thickens the skin, softens fine lines, and smooths that crepey skin people get when they put their eyeshadow on and concealer.
Yes.
It sort of picks up.
Exactly.
The other things are really typically more things that Dr. Remigio and Lynn take care of as far as the hollows, the
Right.
loose musculature, and the skin starting to, change.
That aging process.
Yes.
The aging
Yeah.
process. So what would you say are some of the most popular treatments?
Most popular is the Botox because it's no downtime.
Right.
You come in, it's,
Right.
the most, it's a 10-minute. Of course, I have the gift of gab, so I love to talk to my patients, but that would be the easiest, the fastest, the no downtime, and in our busy society, that means everything. But fabulous results.
It is, but it's not the cure-all. I mean, it's not the panacea of everything for the face. So without going into surgery, I think some of the fillers work well as well.
They do.
As well.
We always say they keep you out of the operating room a little bit longer,
Yes.
But it will help take care of, but it will not do anything for loose skin. That's where Dr. Remigio comes into play because the ocular plastic, and he is the only ocular plastic surgeon in this area.
And so if people are looking for a consult and more information, how do they obtain that?
Just call the office. Just call
We do
us.
free consults.
Yes,
Okay,
we do.
great. And we'll have all that information on the screen. And Thank you for joining us today.
Come see us.
We will.
Yes.
We will.
Thank you.
And we'll be right back with Talk of the Town.